Hello, class. Professor Cisneros here. I apologize that this is a little bit later than I like to do the wrap-ups, but I wasn't able to do it due to a respiratory issue, but that's not important anymore. So, the this past week, you were asked to compare the CRO, actually the CRA models of a CRO, independent CRAs, and sponsor. And what you were asked to look at was numbers related to timelines and budgets and that sort of stuff. And all of that is very important. And it's very easy to take all of that because it's very objective. Now, what's a little bit more difficult is looking at the specific situation in which you're presented, taking your experience and then applying that to the same situation. So, as always, there's an objective part, and then there's a more subjective aspect to it. And what I'm going to share with you is my experience with all three models and a variety of different situations in which all three have been proposed and what sort of came into play. As always, and I've said it 1,000 times, I'll say it again, is that every situation has to be looked at on its own merits. There are going to be situations in which, say, an independent CRA is, or a group of them, is more appropriate than hiring a CRO versus using anybody in-house. And as time goes, so let's say, and it strikes me that about every 10 years, the pendulum within the industry sort of swings from having in-house CRAs and utilizing them all the way back to outsourcing everything. Right now, we are at a point where it's leaning towards outsourcing everything. In-house CRAs, as somebody told me not a couple of days ago, are going by the way of the dodo bird, was the exact quote. At the present time, they that was said years ago. Situations change. All right, so I'm going to go through and I've put together a number of things, and so forgive me as I look at my list, and so I don't miss anything. So independent CRAs, the advantage for independents is that they tend you as the sponsor have an opportunity to be able to select and look at these. Usually, almost certainly, somebody does independently and individually, and then you can choose knowing where they live. So let's say that you have sites in northern, in the Northeast. You can choose an independent CRA that happens to live in that area or very close to it, thereby reducing travel time and travel costs and whatnot. Whereas if you go with CROs, if you go with a CRO, you're not going to necessarily have that option. They'll talk a very good game and they'll tell you, we will do our best to find somebody in that region. But depending on the size and depending on the circumstances, sometimes if you've got, if you're using a small CRO, you may or may not have that. The same thing goes with the larger CROs. I'm thinking about it because I've used CROs of all different sizes, but I think the point is that you have less control. You pay with an independent. You pay for work alone. So when so you only pay for the hours of which they're on the job, as opposed to a CRO. And this can go both ways. This can be a good thing or a bad thing. With a CRO, you're going to be looking at a fixed cost. Now, the job of somebody who is calculating this on a CRO is to predict probably predict that they're going to be doing more work than they actually believe, or charge that they're going to be doing more work than they actually believe. So let's say that you're going to allocate them at 100%, and if you exceed that 100%, well, that's going to be an out of scope, and you may end up having to require another person. It can get very, very complicated. And again, I've been through that before. With independent CRAs, there's just somewhat more flexibility there. Again, every situation is going to be very different. But one of the downsides of an independent CRA is if they leave, you as the sponsor are usually responsible for replacing them. Now, this is an additional twist to all of this, is that there are plenty of agencies that can act as an intermediary for selecting an independent CRA and even managing, which is far cheaper than a CRO, but it does add an additional cost to it. There, even if it is less than a CRO would charge you. If you have quality issues, it's far easier to replace them, and you're going to see it. You're going to see it much, almost certainly much quicker. A CRO will usually try to compensate very quickly if they begin to detect quality issues, and I hate to use the word cover up, but they'll try to fix the situation behind the scenes before it ever gets to a sponsor. With an independent CRA, you get to select, you get to interview them. With a CRO, the likelihood with most CROs, I can't think, having had CROs on any of the studies I've ever done, I've never interviewed prior to them being selected and put on my study. There were times where, especially as I'm thinking about a particularly large study that I did a number of years ago, where I was interested in talking with the CRAs, not because I wanted to scold or because I was angry with any of the CRAs, but we were presented with a situation. I needed to know from the CRA what they were seeing. Since they were on the front lines of a particular region, there were things I wanted to hear directly from them, rather than the multiple levels that it was having to go through within the CRO before it finally got to me. And I was thwarted at every turn by the CRO, and I was, quite frankly, I was never able to even talk with the CRAs directly in that situation. Sometimes when we had visits to a particular country, I had an opportunity to meet and talk with them, and then I was able to get some additional information. But I was never allowed to actually call them and talk to them directly. I always had to talk to probably multiple managers above the CRA before I could to gather any of the information I needed. Going on to the CROs, they are expensive because not only are you paying for the time, but you also have to pay for all the other stuff that it takes for a CRO to work as a company. Everything from physical plants, that is buildings, to benefits, and so there's a significant cost to that. My experience is that there has been there's a high turnover rate compared to the independent CRAs, and when you start out, let's say with CRA 3s, the likelihood, at least from what I've seen, is that they will often be replaced with 2s or even 1s. And but the price that you're paying was established when you had 3s on board, and so that changing that cost, if you even want to, because you may demand that a 3 be replaced by a 3, that it's going to take longer to replace and things go slower, and just excuse after excuse. And if you want somebody going out to the sites, then we can accompany and make sure that they're trained. And it's just I just found it just a little disconcerting with the independent CRAs. There's while the cost for that particular CRA per hour is going to be higher, it's actually going to be less per hour than what you're paying to a CRO, because you have that middleman, and sometimes it's even that there are multiple middlemen for that CRO. On the plus side, if the CRA quits, like I had mentioned before, obviously the CRO has to replace them. You don't, as opposed to the independents. Let's see. Travel costs are usually higher because they're not usually regionally located. You don't usually have the choice with the CRAs that you get at a CRO, especially if you're talking about a large. And I'm usually talking about large studies. If you go into a small or a niche CRO because you need that there are additional services that you require beyond the CRAs, and you only need 2 or 3 CRAs or just a few beyond that, then you probably will have an opportunity to be able to interview a number of CRAs. My very first job in the industry when I was coming out of nursing was for a small study, and because of my particular background in intensive care and emergency room work, I was hired by a CRO, and then I was actually interviewed by the sponsor because they only needed, I think it was 5 of us, and so they had an opportunity, and it was a very large CRO, and they had an opportunity to do interviews, and so they did that, and they from the group of about 10, they selected I think they selected 5 of us. So it is possible, but again, when I conducted very large studies, I never had an opportunity to meet any of the CRAs. I did look at some of their CVs, but not interviewed anyone. And this was very interesting. The last point with the CROs is that you may have a CRA that is quote unquote 100% dedicated to your study, but one of the mistakes that I've seen even at a director's level that they failed to understand was that if you have them at 100%, that doesn't mean that you can have them do whatever you want at any given time. They still have to maintain their training, and so part of that 100% is they're taking care of other tasks internally. And sometimes, and I've seen this when I worked at a CRO, is that sometimes they're diverted to other tasks for other sponsors, and you may be paying them 100%, and something that either sponsor will never know is that they're also doing, and it's assuming that they have time, they're doing a little bit of work on the side for somebody else. Now, if you have CRAs that are in-house, currently it's not it's a trend, like I said at the very beginning, to outsource everybody. But I know that at some companies, especially one that I'm thinking about that I used to work at, they still have a core within the. I don't know if they have anybody outside of the U.S., but I know that they have a group of CRAs and CRA managers in-house, and they take care of a number of things, but they are expensive. They are full-time employees, and so you have to provide all of the benefits that go along with an in-house employee. There is some advantage to it, but they don't typically handle a study all by themselves unless it happens to be very small and within a very small region, say just the United States. And of course, they have to have the resource, the time to be able to do that. But most of the time, they're just they spend a lot of time overseeing. They either act as the regional group within the U.S., working in conjunction with other groups. Let's say a CRO is handling everybody outside of the U.S., and so they may work in conjunction, and so the situation can get very messy very quickly, complicated. Not necessarily a bad thing, because I've done that before. They may oversee some of the work that the CRO is doing because they're very familiar with practices of CRAs and CRA managers. So, but the point is that the CRO, or rather the sponsor CRA group, is at the present time within the industry is fairly small. Now, one of the advantages of having, say, a CRO is in utilizing the CRAs that they may provide, is that there may be say other items and that they'll be able to provide, say a CTMS, and so when you start attaching and needing other things from a CRO that you may not have as a small sponsor, such as a particular program, an IDRS, or like I said, a CTMS, which is the clinical trial management system. When you combine it all as a package, that can be very attractive. Again, a lot of the stuff is very difficult to put on paper, and for a single week with the database, or rather the discussion board, it can get very, very messy very quickly and very complicated. So I like to do this in the wrap-up. I think that's enough for now on that. If anybody has any questions related to those CRAs or what they of either or any of the groups, feel free to reach out to me, email me. Now, next week, as you know, there's no discussion board for next week because you have your assignment, and the topic is going to be a discussion about low enrollment and essentially how to address that as part of a PowerPoint presentation. You're going to have develop 3 root causes for the low enrollment, develop solutions, your SMART goal. All of that is written down, and you all can do it. I'm sure that you all have looked at that. Now, as far as the PowerPoint presentation is concerned, a few items. There is information there that some suggestions on how to improve it, and let me stress some of them and maybe add a little bit more flavor to it. First of all, one of the reasons why we have a PowerPoint presentation is because as a project manager, the likelihood that you'll be developing PowerPoint presentations is very, very high, and you have to be able to present. Unfortunately, presenting information before large groups of people is probably the single largest fear that, as humans, that we have. And so there are ways to be able to get through it. First of all, you have to rehearse, and this is no different. The first couple of lines that you are going to be saying, you should know and know very, very well. After that, it's a good idea to speak to the slides. Don't read them. Anybody who's going to be in your audience can read the slides, and it becomes very distracting when you're simply reading what they are reading as well, only you're doing it out loud. So you want to put enough information in the slides for somebody to be able to look at them after the fact and know what was discussed. So you put bullet points are fine and even encouraged, and then you speak to it. One of the things that you don't want to do is let's say that you put 3 or 4. Let's say that you put in your 3 root causes. Don't go and add a 4th or begin to discuss a 4th that's not on your slide. Let's see. Finally, the enrollment graph. The enrollment graph is very important and something that I've seen really that was not taken, to me, wasn't, when I looked at it, wasn't taken very seriously. Obviously, you're going to have an X, you're going to have an X-axis and a Y-axis. Be sure that you identify what each is going to signify. Is it going to be time? Is it enrollment? What is it? And be sure that it makes sense to you. You may even have somebody else take a look at it and say, okay, so what's happened here? And you'll be able to deduce exactly what's going on here. Just having an open square with a couple of squiggly lines that show it going up if it's a meaningless graph, and somebody in upper management were to take a look at that, they'd probably ask you to go back and redo it. And believe me, you don't want anybody from upper management doing that. So be sure that the graph makes sense. And quite honestly, that might be the most difficult part of it, of the paper, maybe. I know for some people the formatting and whatnot. So give yourself plenty of time to be able to do that. If there are any questions, by all means, as always, send me an email or even a text message if you're pressed for time. Quite honestly, my phone and my text messages are always there. If you want to send an email because it's a complicated question, and text me just to alert me that the email has been sent, that's fine too. So good luck, and I look forward to reading your papers.